Hi, good evening, everybody. So tonight I'm going to talk about kidney stones. Sorry, the delay on this. The last time I was having some technical problems with the camera. So hopefully all goes well tonight. So as part of the introduction, kidney stones, those are becoming more and more common as time goes on. Used to be about 1 in 20, now it's about 1 in 11 people develop kidney stones over the course of a lifetime. 19% of men, 19, that's a lot of yes, and about 9% of women will have a kidney stone by age 70. So over the course of a whole lifetime. So listen up, everybody, because kidney stones are very painful. I've talked to women that have given birth to babies and that have developed kidney stones, and they say the stones are equal to or more painful than a baby, and there's nothing to get besides this little rock at the end, sharp, spiky little thing. Not very cute. So let's learn about things you can do to help prevent kidney stones. So kidney stones are usually made of a few simple substances. Calcium is the most common. Oxalate is another kind. Much more rare is a kind of stone called cystine, that's Cystine, and also uric acid is another kind. So those are the four main kinds. The most common is the calcium ones and the oxalate type. So basically, calcium oxalate is actually the name of the most common kind of stone. But those are the four main substances that combine and fall out into the urine. So I've been seeing quite a few people lately with kidney stones in the clinic, so that's why we're having tonight's talk on kidney stones. So usually the stones will form if any of those four substances are at high concentration in the urine. So if you think about it, it's kind of like if you have a cup of water and you keep adding a little bit of salt, a little more salt, a little more salt, a little more salt, a little more salt, and eventually the salt will form crystals towards the bottom of the glass. It's a very similar sort of thing that's happening in our urine system. So if you've got a little tiny bit of urine, in other words, not drinking very much fluids, and so the urine gets concentrated, then all of the solutes, the stuff that normally gets flushed out of the body through the urine, gets more and more concentrated. And so if there's high levels, especially of some of these substances, high level of calcium, high level of oxalate, cystine, or uric acid, well, just like the salt forming a little crystal in the glass, these things will form a crystal in the kidney, which is not fun at all. As mentioned, these things, when they come through, I don't know if you guys have ever seen these little spiky burr things. We call them sand spurs down here. It's kind of basically it's a seed of a type of plant that really sticks to the clothing. It's sharp, spiky little edges. Well, these stones are not quite that spiky, but they're pretty close. And so as they form in the flank area, and then kind of wrap around and go down the ureter and then pass out through the urinary system, they scratch it all up along the way and cause people intense pain. We call that renal colic, renal just meaning another word for kidney colic, and colic means a type of squeezy, crampy, awful pain, and it squeezes and it clamps and it's ouchy for like 20 or 30 minutes, and then it relaxes for a little bit. And then the stone moves a little bit further down and scratches another part of that inner organ, the ureter, that tube that leads from the kidney down to the bladder. And then it goes, and it cramps again for a while. So again, these are can be very intense, painful things. And one of the other things that makes these so sore is that as the stone is traveling down and moving along that little tiny tube on the inside, well, the kidney, its job is to make urine. It's got to make some pee. And so it doesn't stop doing its job despite the fact that there's a stone kind of blocking the tube, blocking the outflow pipe, so to say. And so if the stone is blocking that outflow, well, guess what? The urine backs up, and it starts putting pressure back up on that kidney, which is called hydronephrosis, if you want another big, long Latin word for your night tonight. But that water around the kidney, that urine that's kind of pushing back on the kidney, sometimes can damage the kidney as well. And that's one of the reasons why when we suspect that somebody might have a kidney stone, we very often will send them off to the emergency room to get the CT imaging, which is for most of the stones the best imaging to be able to see exactly where is the stone, confirm that there is a stone, of course, and also to see how big is the stone. Because that little tiny tube, it's just a few millimeters across, and yeah, it can kind of expand a little bit to pass it along. But if the stone is too big, then it gets stuck in that tube and it can't pass on its own. So sometimes urgent intervention is needed in the form of, sometimes the urologist will go up. I'll leave that to your imagination. I don't know how they go up, but they go up inside to go grab the stone and bring it out. Sometimes they will use, we call it lithotripsy, but shock waves, kind of a sound that goes kind of pushing with ultrasound on there. It's not a physical pushing, but a type of energy that can kind of get deep in there and kind of rattle things up and try to break up the stone so it's becomes small enough to fit through the tube and pass. And of course, pain management, because these things are intensely painful as they go through. And usually people will pee out a little gravelly type of substance. So, but that is the main reason why we'll send people to the ER for diagnosis, because you kind of got to know early on, hey, are these little itty bitty tiny things that given enough fluids and enough rest and enough pain medication will just make their way out on their own, or is there a high likelihood that they're going to be stuck and will damage or kill off the kidney if it's not intervened with? And so that's another reason why these stones are so important to learn about, because not only is the frequency of stones rising in our population, and we'll look at that in a minute as to factors that might be reasons why that's the case, but also because time is of the essence. If the kidneys can stand a little bit of pressure, but if there's that pressure going on for a long time, then the kidneys function might not be working quite so well. And you got two kidneys, but you really don't want to lose one if you don't have to, of course. So, all right. So there are some body conditions that can also trigger kidney stones, and I've got a little list here, and we'll just kind of breeze through. So the one I mentioned in the beginning is not drinking enough fluids throughout the day. And I can definitely understand sometimes we get busy, working long hours, not enough time to drink or forget to drink or something. And basically, your best goal is to have about 10 to 12 cups if you're a known stone former. If you're not a known stone former, then probably somewhere between 8 to 10 cups is probably a good amount of fluid to imbibe. And that doesn't have to be plain old water. I often recommend putting a little green tea or hibiscus bag in there, because that way at least you're getting the benefit of antioxidants and all sorts of other good, healthy, cancer-fighting, health-benefiting nutrients along with your plain old water, So it's just an easy way to getting lots of good stuff in the body at the same time for very cheap. So lots and lots of fluids. Basically, as mentioned in the beginning, the idea is to dilute out that urine so that it does not become concentrated, so that the stones don't even think about forming in the first place. So a diet that's low in calcium has been associated with kidney stone formation. My favorite sources of calcium are the fruits and veggies, especially the veggies such as broccoli, because if you get broccoli, not only is it rich in calcium, but you get all sorts of other awesome broccoli properties to it that helps with stimulating the liver to detoxify itself. It's anti-cancer. It's all sorts of good stuff. So maybe one of these days I'll do a video just on the health benefits of broccoli and broccoli sprouts and all that good stuff. But diet that's rich in calcium. And again, if you listen to my videos, you know I usually recommend plant sources of calcium over the animal sources because the plant sources come without all the loaded hormones and antibiotics and things like that that can also be troublesome to the health in the long run. Use of calcium supplements. So this is another area where medicine is starting to change its tune a little bit. Back in the day, we used to recommend everybody that was female and a certain age basically have calcium supplements, give them out like candy essentially, with vitamin D, of course, in it. And over time, it's been found that you gotta weigh the risk and the benefit of that a little bit. The women that were given the calcium supplements ended up with more heart attacks and more things like these kidney stones as well. Partly because if you take a whole bunch of calcium all at once, well, where is it gonna go? It's gonna concentrate in the urine. It's gonna form stones. If calcium likes to go where there's inflammation, and so if the arteries are inflamed, then the calcium will pave the arteries and harden those arteries as well. So for those reasons, for the general public, I usually don't recommend calcium supplements anymore. If you'd asked me this question about 10 years ago, I'd been like, oh yeah, everybody needs to get this amount, blah, blah, blah. But again, you got to keep following the science, and as the opinion starts to change, yeah, and just follow the path of least harm is my goal with all of this stuff. So calcium supplements, definitely not a go anymore. The one exception is, and check out, I'll do a video on osteoporosis, and we'll talk about some of the risks and benefits with that later on. But tonight's about kidney stones. A diet that's high in animal protein. So you guys might have noticed a recurring theme. And basically the animal protein amino acids, basically when you eat the flesh of the muscle tissue of an animal, which regardless of which animal it is, that is made of protein, and that's made of amino acids, and acids form stones. It puts a really heavy burden on the kidneys, and also the kidneys have a tendency not only to be more stone forming, but also to just have a higher workload. It's more difficult for the kidneys to clear out those proteins as opposed to the plant proteins. And also your beans, wheat, rice, rye, and barley. So those are all very high plant sources of phytate. Now, phytate is an ingredient that is protective. Now, when I mention an ingredient like this, something that just happens to form naturally in the plants, I do not mean go out to Amazon and look for phytate capsules, because again, anytime you try to isolate one of these little components from something, you're missing out on all of the other wonderful antioxidants and other fibers and other things that make that whole plant food extra awesome for the body. So again, foods that are rich in phytate and protective against stones are your wheat, rye, barley, and rice, and beans. So beans, extraordinarily healthy for you, great source of protein along with those other whole grains, and can be very healthy in multiple ways. So a diet that is high in sugar, and especially the kind of sugar you get from those soft drinks. So soft drinks are very rich in your sucrose and fructose syrups, basically. If you get it in the form of fiber-rich apple or grapes or fruits or vegetables, those naturally occurring sources, again, are not like pharmaceutically processed and really good for you. So again, our diet happens to be, for a lot of people, high in sugar, high in salt. And guess what? High salt diet also increases the risk of stone formation. One last food that can increase the risk of stones potentially is spinach. Generally speaking, I recommend people eat lots of dark green leafy vegetables. Spinach is the one that you might want to be careful of if you're a stone former. If you have a diet that's very low in animal protein, low in salt, low in fat, all that other kind of stuff that we talk about for a healthy lifestyle. Anyway, I believe there's a much lower chance of that spinach oxalate binding to stuff and causing a problem, especially if you're flushing the body in general. The one thing that you can do to make that spinach even healthier and easier on you if you happen to be a stone former is to very lightly steam it. If you steam it just a little bit, that will drop the oxalate content and make that wonderful vegetable even healthier for you, especially if you are a known stone former or a family history of stones in particular. Also, once someone is identified as forming kidney stones, it's important to come in to get a checkup and find out, all right, was it my diet? Was it something else that was triggering those stones? Because there's a few different metabolic issues that can cause stone formation. For example, high parathyroid function. So the thyroid is a gland that sits right here in the neck, and sitting on top of it like little tiny jewels are something called the parathyroid glands. And those glands really regulate the balance of calcium in the body. And it is very important if you've got high parathyroid hormone, if that gland is going out of whack and going high on you, then it can basically thin the bones. And as it leaches the calcium out of the bones, guess where that calcium goes? It goes into the urine, it can form stones, and basically, cause misery. So high parathyroid hormone is something to avoid. Now, paradoxically, we're in an environment where a lot of people are spending a lot of time indoors, no sun, no vitamin D, no nothing. And so when we're indoors all the time and like I'm a little bit bundled up tonight, wearing your clothes, going outside, wearing your hat, basically we're all covered up these days because no one wants to be in the sun very much anymore. And so if you are indoors all the time and have a tendency to have very, very low vitamin D levels, then bringing the vitamin D up gradually over time will help stop the overproduction of parathyroid in some cases. If your parathyroid's going off on its own, there's other things that can cause that too. But it's important to identify that and get it checked out if you happen to be a stone former. Gout. We haven't done a video on gout yet. That's going to be so many things to make videos on. So the gout, the uric acid, that is the main thing that causes trouble down in the big toe usually. Sometimes the knee, sometimes the ankle, sometimes other spots. But that same uric acid, it can also precipitate into the kidneys and cause painful stones. So next, diabetes. Diabetes increases the risk of a bazillion different things. Please check out my diabetes videos that have been done already. But yes, kidney stones are higher, more common in diabetics than others. Obesity, the extra weight, basically associated with stones. An intestinal disease called Crohn's disease is also higher risk as well. So it's another very inflammatory state as well. And then finally, even though obesity is associated with an increased risk of stones, so is a gastric bypass or intestinal bypass surgery as well. And so it's a little bit of a catch-22. Sometimes people will choose these surgeries, and for many people that can be a very beneficial surgery. Of note, Dr. Greger on nutritionfacts.org is a beautiful video presentation regarding some of the research where they very simply put the people that were going to have the bypass surgery on the same exact diet, same exact meal sizes, same portions, same everything as the people who had already gone through the gastric bypass surgery. And guess what? They lost the same amount of weight without all the, surgical stuff. So there's other ways of losing weight in addition to that one tool. So I encourage you guys to check out my videos on some of that as well, or go to nutritionmd.org and just check out the recipes. On average, most of my patients that go through and play with the 21-day kickstart and all that stuff usually lose about 10 pounds a month on average, and very sustainably so as well. Plus, they usually get much healthier in other ways too. So anyway, this is just a quick introduction to the kidney stones. In a few moments, I'm going to come back and we'll go through a few more details on some dietary things that can be helpful. So see you again in just a few minutes. Thanks for watching.